Welcome. Today we're diving into mixed connective tissue disease, or MCTD. This rare autoimmune disorder presents a complex puzzle for both patients and doctors, as it shares features of several distinct conditions like lupus, scleroderma, and polymyositis. Join us as we unravel the mysteries of MCTD from its causes and symptoms to its diagnosis and treatment. While the exact cause of MCTD remains unknown, researchers believe it's a combination of genetic predisposition and environmental triggers. It's not directly inherited, meaning you won't necessarily get it just because a family member has it. However, certain genes may make individuals more susceptible. Environmental factors, such as viral infections or exposure to certain toxins, might then act as a trigger, kicking off the autoimmune response that characterizes MCTD. More research is needed to pinpoint these specific triggers and fully understand the role of genetics. At its core, MCTD is an autoimmune disease, meaning the body's immune system mistakenly attacks its own tissues. In MCTD, this attack primarily targets connective tissues, which are the tissues that provide support and structure to organs, muscles, and joints throughout the body. A key hallmark of MCTD is the presence of high levels of a specific antibody called anti-U1 ribonucleoprotein, or RANP antibody. This antibody is thought to play a significant role in the inflammation and damage seen in MCTD. The inflammation can affect various organs, leading to a wide range of symptoms. MCTD is considered a relatively rare disease. Estimates suggest that it affects fewer than 1 in 100,000 people. It's more common in women than in men, typically appearing between the ages of 20 and 40, although it can occur in individuals of any age and gender. The prevalence may vary in different geographic regions and ethnic groups, but more comprehensive epidemiological studies are needed to fully understand its global distribution. MCTD is a master of disguise, often presenting with a combination of symptoms that resemble other autoimmune diseases. Common signs include Raynaud's phenomenon, where fingers and toes turn white or blue in response to cold or stress, swollen fingers and hands, muscle pain and weakness, joint pain and inflammation similar to arthritis, fatigue, skin rashes, and difficulty swallowing. In some cases, MCTD can also affect internal organs, leading to lung problems like pulmonary hypertension, heart problems, and kidney involvement. The specific symptoms and their severity can vary greatly from person to person, making diagnosis challenging. Diagnosing MCTD can be tricky due to its overlapping features with other autoimmune disorders. Doctors typically rely on a combination of clinical evaluation, blood tests, and imaging studies. Blood tests will look for the characteristic anti-U1 RANP antibody. They may also check for other antibodies associated with related conditions like lupus and scleroderma. Imaging tests, such as X-rays or CT scans, may be used to assess the involvement of internal organs, such as the lungs and heart. A definitive diagnosis often requires careful monitoring of symptoms and disease progression over time. While there aren't distinct subtypes of MCTD, the disease can manifest in different ways with varying degrees of organ involvement. Some individuals may experience primarily musculoskeletal symptoms, while others may have more significant lung or heart involvement. Doctors often classify patients based on their predominant symptoms and the extent of organ damage, which helps guide treatment strategies. There is no cure for MCTD, but treatment focuses on managing symptoms, controlling inflammation, and preventing organ damage. Medications commonly used include corticosteroids to reduce inflammation, immunosuppressants to suppress the overactive immune system, and medications to treat specific symptoms, such as Raynaud's phenomenon or pulmonary hypertension. Physical therapy and occupational therapy can help improve mobility and function. Regular monitoring by a rheumatologist and other specialists is crucial to detect and manage potential complications. Because the cause of MCTD is unknown, there's no proven way to prevent it. However, minimizing exposure to potential environmental triggers, such as smoking or certain toxins, may be beneficial. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can also support overall immune function. The prognosis for individuals with MCTD can vary significantly. Some people may experience mild symptoms that are well controlled with medication, while others may have more severe disease with significant organ involvement. Pulmonary hypertension is a serious complication that can affect long-term survival. Recent research is focused on identifying biomarkers that can predict disease progression in response to treatment. Clinical trials are also exploring new therapies, including targeted biologic agents, that may offer more effective control of the disease. Early diagnosis and aggressive management are key to improving outcomes and quality of life for people with MCTD.